So once you log in as a user who is assigned the screenings and management role, on the left side of the screen, you will see the Pages menu. When you expand that menu, you will see a list of submenus that will appear on your page based on the permissions that you are assigned. If you are assigned care registration permission, you will see the care registration and initial evaluation submenu. If you are assigned psychosocial support or adherence counseling, you will see the psychosocial support / adherence counseling submenu. So these two submenus will be our focus for today. So we will start with care registrations. Under the care registration submenu, you have a link to view all HIV care referrals, a link to view all TB care referrals, and a link to view other referrals. So when you click on View HIV Care Referrals, you will see all of the clients that have been referred from different health centers to be registered into care. Any client on this list is not yet in care. Once you register a client into care, they will leave. You will no longer find that client on this list. You will see the date of referral.
Could you repeat that, please?
Okay. Okay, some people just joined in, so I will rewind back. When you go to your care registration and initial evaluation submenu, and you expand that, you will find links to the different functionalities under this submenu. View HIV Care Referrals will give you a list of all of the clients from the different health centers or sites that have been referred for care registration for HIV, both general and antenatal population. Any client you see on this list, it means that the client has been referred but not yet in care. Any of these clients that gets registered into care, you will no longer find a name on this list. So this list holds the list of the clients who have been referred but not yet in care. Now you will have 4 categories of clients. You have the adult, the pediatric, the pregnant, and we also have the 4th one, the adolescent. And the reason for these 4 categories is that most of the adolescents, the system will generate adult clinical management forms. So you want to be sure that if you have somebody who is 15 or 16 years old, you might not want to place them in pediatric, right? Because the forms generated will be too child-specific for that age. And so when you select adolescent as the category during referral, then the system will know that the forms generated will not be those child forms, but on the other hand, knows that they are not like full adults yet. So that is the reason for the 4th category. Every pregnant client is going to have adult generated form. The reason for the pregnant category is for the clinical care nurse to know that this pregnant client is not yet in care and you want to make this a matter of priority or urgency to contact and make sure that the pregnant client gets into care as early as possible. So on this list, if you have the names of the clients entered at the time their account was created, you will find their names on the list. You'll find their date of birth and their gender. So this gender here refers to the biological sex. So I'm going to change the heading so that you know. Once the client walks into the STI clinic or the IDC clinic, if you come to this list, you can copy the unique ID of that client, and then you will go back to your care registration and initial evaluation submenu and select HIV Care Registration. You put in that unique ID there, and then you get registration form. So for every client who is not yet in care, you will find this form. If the client is registered into care, it will give you an error message telling you that the form has already been used. So once you get to this form, it means that this client is not yet in care and it's time to register the client into care. So all you need to fill into this form is the date that you are registering the client into care. You can see the name of the person who referred and the date of referral. So we will register this client. So now this client is in care and the form has been used. You will come back now to the care registrations and initial evaluation drop-down menu. And then the next thing is to do the initial and clinical evaluation. So here's the pattern. For HIV care registration, you view HIV care referrals to make sure the name is on the list. If the name is not on the list, it's either the client was not referred or the client has already been registered into care. If you want to find out why the name is not on the list and the client is sitting in front of you, you can come back here to look at the list of those who are in care. And so I can come back here and I'm going to view HIV care registration list. And this gives me the list of all adult and pediatric clients in care and all exposed infants in care. And then I'll find the unique ID here, meaning that the client has already been registered by somebody else. If I don't find the unique ID here, then you need to call the health center or the testing site to do the referral of the client electronically so that the name or the file can be transferred here for you to register the client in care. Any questions so far?
I'm a little bit lost.
Okay,
When
so
you view the referral list, and then you select the unique ID number, where do you go from there?
Okay, so when you view HIV care referrals, right? This is for you to verify that the person was referred electronically. You can copy the unique ID. If the person is in front of you and they give you the unique ID, you verify that this person has been referred. So which means that you have the file, you just need to register the client. So when you take that unique ID, either you copy it or you just verify it is on the list, and then you come back to care registration and initial evaluation and go to register HIV care registration to register the client. So for HIV, you are going to view HIV care referrals, then you are going to HIV care registration. And if that person was an adult or adolescent or pregnant, you go next to initial and clinical evaluation. If the person was a child or a pediatric referral, then you go to pediatric initial and clinical evaluation. So you view HIV care referrals, make sure the name is on the list. If the name is not on the list and you want to verify if the person has been registered in the past or from another site, then you come here to look at view care registration list to verify if the person is already in care at another site. That is why the name is not on the list. And if you still don't find the name in the HIV care registration list, then it means that the testing site where the person was tested did not do the electronic referral. So it's either you want to go to referrals and do it yourself, or you want to call the testing site to do that referral. Is it clear now? So is it clear now?
Yes, please. Yes, please.
Okay. Okay, so now we have registered someone into care. So I'll get back the unique ID of the clients that we registered. So we registered this client into care just now, and we want to look at the initial evaluation of the client that was just registered. Because this client's category is an adult, I'm going to go to initial and clinical evaluation. If the category is pediatric, then you go to pediatric initial and clinical evaluation. The forms are totally different. And if you are going to do an initial evaluation for an exposed infant, then you go to exposed infants evaluation. So we want to do this for an adult. And we have the initial evaluation form. This form collects the basic enrollment information, like the date confirmed positive and the date of enrollment, the age at enrollment. If this is a transfer in or somebody who was on PrEP or PEP or has had any ART exposure in the past, you will want to fill in the other section below. So we are going to put the date confirmed positive, which is a day of referral, to be the first day of February 2022. The date of enrollment is today. And the age at enrollment, the current age is there as 40. So if you're entering a past record from a file, you will have this information and then you put it in. If, for instance, this client was on PrEP or PEP in the past, or it's a client that became positive because they realized they were positive during an antenatal screening, and then the only exposure they've had was PMTCT exposure, then you select PMTCT only. If the person was on post-exposure before now, you put it in. But if the person was on none, you select none, or just leave it blank and don't bother about filling the form below. So if the person was on a particular medication in the past, for any reason, you select the reason, you put in the drug regimen that the person was on, the date the person started, and the care entry point for that person. So because in this situation, this is not necessary, we are going to leave this session. So we'll leave this section and I'll click on submit. So once you fill in the enrollment information, you will have things like the dates faded up above for you to be able to see what the last information you filled in was. And you can always update it in the future if in the past you had this, you were told about this information, but you don't have the card to verify and put in this information, and the person comes back another time, you can come back to this form and fill in the fields that are missing and submit again for it to update. The next form is the baseline information. And this collects information about the initial weight of the client, the initial clinical stage, the dates that ART is started if the client is on ART, and then information for the pharmacy. So if you have a treatment supporter or who is going to pick up the medication, if the client is too ill to pick up medication, and what the relationship is with the person, so that if somebody else is picking up the meds, the pharmacist can verify the name of the treatment pickup that was listed on the client's file. So the date started ART. So this client is not yet on ART, and so we are not going to put the date started. But we're going to take the weight. And the initial weight is, let's say, 167 pounds. And initial clinical stage is stage 1. Let's say the client is asymptomatic. And the client named Moses John as his brother, who will pick up his medication whenever he cannot. If he has a home-based care provider, you put in the name, and then you list in all the drug allergies that this client has. So let's say the client is allergic to chloroquine, allergic to codeine, allergic to cephalosporins. I hope my spelling is right. So we listed the drug allergies, and then we submit this. So the next information you want to collect is the clinical stage. This just asks you for the dates of the first clinical stage 1 or 2 diagnosis, of the date of the third stage 3 diagnosis, and the date of the stage 4 diagnosis for the client. So this client is stage 1, and let's say today is the day where you have said this client is in stage 1. So we are done with enrollment, baseline, clinical staging. We want to get a baseline Cd4 count. So if you do baseline CD4s before you place the client on ART in your country, you put in the date you are taking that sample or you are requesting for the CD4, and you save. But if you are filling in this form when you already have the results, then you put in the date that the sample was taken and then the Cd4 value for the client. If the Cd4 value is less than 350, that's cells per millimeter cube, right? If the Cd4 count is less than 350, then you want to fill in the dates. If it's less than 200, you want to fill in the dates and you put in the same values here. But because the Cd4 cell values is 750 and is greater than all of these values, I only have to fill in the first one and I will click on submit. So once I have this submitted, I will go to the viral load information. If I want to send for viral load test also, I'll put in the date I'm sending and submit. But if I have a result for viral load, let's say the person has 30,000 copies per mil, and then I will submit this. So when you come to the initial evaluation form, fill in the information you have, and then come back to this form later on, maybe in the next visit, when you have more information to update the form. If in the future, the client advances from stage 1 to stage 3, or stage 1 or 2 to 3, you come back to clinical stage here and put in the date where you have your first stage 3 diagnosis for the client. If the client advances to stage 4, you want to come back to this form and put in the date when the client gets to stage 4. Once you are done with all of this, the enrollment and clinical initial evaluation is done. It is time for the client to see the adherence counselor or go for psychosocial support. So regardless of the population the client belongs to, whether adult or pediatric or pregnant, the process is the same when it's time for psychosocial. Has the clinical care nurse or the person who is taking in this information, you will have the appointment or patient monitoring permission granted to you. If you have that permission, you will go to schedule counseling appointments. If you do not have that permission, just send them to for psychosocial support, and they have the psychosocial support or adherence counseling permission. And this adherence counselor now is going to schedule the counseling appointment. Either the appointment will be on the same day or another day in the future, but the system does not put a date tag to the counseling appointment. So whenever the client walks in, you can have the assessment. So for the social workers or the adherence counselors, there are 3 types of assessments. We have the adherence readiness assessment that you do before the client is placed on ART, as soon as the client is positive and registered into care. We have the adherence strategy work plan that you use when you cannot decide if the client is going to be adherent or not. And then we have the adherence follow-up assessment that you use on the return visit after the client has started ACT. So every time the client comes in for clinical management visit, before the next set of prescription is handed over, you want to look at how they are doing with the past medications, if they were adherent or not. So this is this client's first time, and the client is just ready starting to care. So we are going to give an adherence readiness assessment appointment. You always have to select the appropriate appointment because the system generates forms based on the type of appointment that the client has. And you always have to schedule an appointment because the system wants to generate the form when the appointment is scheduled. If there's no appointment, there is no form. So when you create this appointment, you can go straight ahead on the same day or on a different day to start the counseling encounter with the client. If you want to look at the list of all the appointments you have, you go to pending counseling appointments, and then you see the unique ID, the date of the appointment, which is today's date that it was scheduled today, and the purpose of the appointment. So the system gives you the purpose of appointment based on the type of appointment you selected when you created the appointment. So this client is here for psychological and adherence readiness assessment. You can copy the unique ID, or if you have it, you can type it in when you come back here to psychosocial support or adherence counseling and select start counseling encounter. You put in that unique ID and you get the form that the system created when you schedule the appointment. You will see if a Cd4 viral load test has been done for the client. You will see a flag on the page telling you the next time the Cd4 and the viral load should be done. Now, for the purpose of non-adherence, right, we have Cd4 set to be 3 months from the last time the test is done. And then based on the regulations or how you do it in your country, you can ignore the dates if it's an adherent client and you don't do a Cd4 every 3 months. If you also have a non-adherent client and you're looking at viral loads every 6 months, the system tells you the next time a viral load is due is 6 months from the last time you have done it. So if you see any green banner on the page, it means that this client is not in need of a Cd4 or a viral load test. If you see a blue one, it means that those tests have never been done. And if you see a red one, it means that you need to carefully check if the test was done before and you need to do a new one. And then you use your judgment and your regulation in your country to decide if this is 6 months' time, the client had a viral load 6 months ago, if you want to repeat the viral load the next 6 months, or you don't see the need for it. But the system just gives you flags to give you timeline or checks, periodic checks, so that you can make decisions on what you need to do for the purpose of compliance and adherence. So the counselor sees this, the clinical care coordinator sees this on the page. It always gives flags of important information on the page. So you get the current age and then the form for the assessment. Not all of the fields on this form is required. Some are required and some are not. The form is for both adult or pediatric, and based on the question, you will know who this question is for. For a child, you're asking the caregiver the question, the caregiver who is going to be giving the child the medication. If this is the first session of the client, you're asking how many sessions of pretreatment counseling did this client attend? So this is the first one and the only one, so put 1. If the client is coming back another time because the first time the client has said no, they need to think about it, they're not going to be on medication, so this would have been the second time. But right now is the first time. Is the client's treatment literacy sufficient? So you want to know if this client is able to really understand stuff. So you would have gone over all of what you need to go over with the clients, and see if the client can explain it back to you. And then you click yes or no, or no, or not applicable. So if the client is not getting an understanding, then you want to click yes or no. So let's say no. Does the client have misconceptions about ARV? If it's yes, you want to put what the misconceptions are. So we'll say the client said that it kills. That's a misconception. Does the client, or has the client disclosed his or her status? And if yes, to whom? So as this client disclosed, we'll say yes. And the client disclosed his status to his, let's say, spouse. And is this person supportive? Let's say no. The spouse is not supportive because the spouse blames clients for putting the family at risk. Has the partner been tested for HIV? In this case, the partner refers to sexual partner, injection drug partner, and children if it's a HIV positive mother. If we are filling this form for a child who is an index child and doesn't have a positive mother or father, or you don't know the status of the mother or father, then the partner here becomes the mother of a HIV positive index child, the siblings of that child. If the mother is not available, the father of the child. So partner here does not refer to sexual partner alone. So under the partner notification service, we have partners as sexual partners, injection drug partners, siblings, mother, depending on the category of the client. So this partner here, we want to find out if he has injection drug partners, if he uses drug, sexual partners, and then he will say no or unknown. He doesn't know if they're tested yet, but you want to counsel them about testing. So he needs to find out if his spouse he disclosed to has been tested. And during the next session, you want to find out if they were tested, and you tell them the reason why they need to be tested. If the partner has been tested, the partner is positive, you want to put it yes or no if the partner is taking ARTS, and the name of the clinic that the partner attends. So this is not applicable because he doesn't know if the partner has been tested. Does the client have children? If yes, have they been tested? So you're going to counsel on the client on HIV testing for all children. So if the client has children, you put yes. If not, no. And if he has children, you are going to put in what you told the client, and the client respond to the testing of children for the client. So we'll say no. Does the client have a treatment assistant? If yes, who is this person? And so we'll say no or not applicable because he has not started ARTS and he doesn't know if he's going to need a treatment assistant yet. Did the treatment assistant take part in the pre-treatment adherence sessions? So if he's there with his spouse, you can say yes, but now the answer is no. Does the client wish to be visited at home? And if yes, you want to describe the location in details and the contact person. So the client doesn't want to be visited at home. So how will you describe the mental state of the client? So now you are doing your own evaluation and you want to see how the clients feel, the client's mood, or the client's responses. So we'll say the client looks depressed, acts depressed, sounds depressed. Does the client fear discrimination or violence at home or in the community? If he said yes, he fears discrimination, you want to counsel on that discrimination or the violence, and then refer him to a support group if there is any. Who does the client go to for support at home or in the community? If the client goes to anybody for support, let's say the client goes to the district nurse for support in the community. Does the client come to the clinic or on his or her appointment date? So in this case, you do not know yet. This is the first time the client is coming. We don't know if the client is going to be regular, but today is his first appointment. He came today. You choose to put yes or unknown for now. Has the client been adherent to other medications in the past? So you're asking this client if the client has a problem with remembering to take medications, or if the client takes medication at the right time. So let's say he says no, he always forgets when he feels well. So you're asking yourself this question now, not the client. Did you plan a drug timetable with the client? So you know the ads the client is going to be placed on. You want to give the client a drug timetable to get the client ready for the medication the client is going to receive at the end of the day. So if you plan the drug timetable, you're going to put yes, no, or no, not applicable. So no, you are not planning a drug timetable today. Is the client a member of a care and support group? And he says no, he's not a member of any group. If he's a member of a group and you have support groups in the country, you put the group location here. Does the client have any substance addiction? So let's say he said he is addicted to alcohol or he's an alcoholic. Does the client feel confident about taking the medicines every day for the rest of his life? So if this client is a child, you are asking the caregiver if the caregiver feels confident about remembering to give the child medication every day. So he doesn't feel confident about this. If this person is a child, you want to ask who else takes care of the child other than the caregiver present. And if there's any other person who takes care of the child, maybe the grandmom, you want to put in the name of the other caregivers. If the other caregiver has been trained, you want to put yes or no. But if not, and you select no, you have to ask the person to bring in the second caregiver for the next session. So that is in the event that the person you are doing this evaluation for is a child. Has the client had any challenges taking other medications? So maybe TB treatment every day at the same time. He said he always has challenges remembering to take medication. Does the client know the names of the ARVs to be taken and the time? So you would have gone over the medications that the client is going to be on and the time, and see if the client will be able to accurately repeat after you or tell you at the end what the medication names are and the time that he needs to take the medication. If you do that and the client is not successful, no. Does the client know the side effects of these medications? And then you counsel on side effects management. And then by the time the client understands the side effects now, you can click yes. And if the client still doesn't understand, no. Does the client know the consequences of not taking the medication every day for life? So you want to counsel the client on lifelong adherence. If you tell the client about the consequences of not taking it, and the client understands that, you say yes. If the client is on any other medication other than the ones prescribed, maybe the client use herbal medications or those from traditional medicine, you want to click yes if the client say they take different herbal medication. So you want to look at the assessments of the client's readiness to start ART. So based on the questions they've answered, your own judgment as a psychologist or adherence counselor or a social worker, you want to tell yourself, is this client ready to start ART or requires more preparation and counseling? So now we are going to say this client needs more preparation. And then you will fill in whatever other concerns that the client has or questions. Let's say the client says the client is concerned about transportation to the clinic, on clinic days, and getting time off work. And if there's anything you can do about it, you put it there in the box. If there are other issues and notes that you noticed, you can type it in here. If not, it's time to save this form. And you are done with the readiness assessment. Because you have assessed this client and you have said that the client is not ready, The next thing you want to do as a counselor is to now start a strategy work plan to get the client ready. So this client is not ready to leave your office yet because the client is not ready. We are going to give the client another appointment now for a readiness assessment, for a strategy work plan, sorry. So we want to get the client ready as early as possible. So most of the client's concern is that he doesn't remember to take medication. So we have given the client an appointment for an adherence strategy work plan. And then we are going to the psychosocial support or adherence counseling and go back to start counseling encounter. You enter the unique ID and it gives you the form for strategy work plan. So what the strategy work plan is all about is you might want to give the client medications, maybe supplements, vitamins, but in the same dosing as the intended medication. And then when the client comes back, maybe the next 2 weeks, you want to assess the adherence to that medication. Is the client able to overcome his forgetfulness about taking medication? Was there any plan? Did he use alarms? Whatever he used, he comes up with a strategy while trying on other drugs that are not the ARTs. So if you have HIV basic seminars going on in the country, you want to recommend the attendance at the seminar. If not, you put none, there is none in the country. If you have an adherence seminar that is always on, you want to invite the client for the adherence seminars. If not, you don't have any, none. You want to discuss the preferred adherence strategy with the client. So you're going to ask the client if self-managed adherence is the route he wants to go, or he wants to have a treatment partner. He wants to have somebody who always reminds him, if he has maybe his mom or his spouse to always tell him at the time, or he just doesn't want anything for now. So he said he wants to try self-managed adherence. And then you want to conduct a 1-week practice trial to simulate the commitment and attention necessary for ARV medications. You want to select, are you giving multivitamins or you're giving Septrin or whatever it is you are giving. If you're not giving any of this, none. And then you put other medications you are giving and the frequency here. So put vitamin C. And you are going to give vitamin C, or you're going to give calcium or magnesium, anything that is a supplement that is not harmful. And you are going to put the dosing that is going to be exactly the same dosing with the intended ARTs. And then you will now put the client is going to be reassessed on the later dates and save this. So now you have started a strategy work plan, and maybe you give the client a 2-week appointment or 1-week appointment to come back and tell you how he was able to adhere to the supplement that is in the same dosing as the intended ARTs. And if the client feels confident this time, the client is now ready to start ARTs. So on the next visit, when the client comes back after the strategy.
Mildred, before you go on to the next session, the strategy work plan, that will be filled out by the counselor, right?
Yes.
But how are you gonna do the medication part, in where that counselors does not prescribe medication?
So all of those medications are over the counter, vitamin C, anything. So before the client comes in, the counselor would have had a discussion with the clinical care team, and they already know what they normally give people who are not ready, but they want to get them ready. So the counselor, so if your rule is, if you decide in the clinic that we want to give everybody vitamin C, and we want to make the vitamin C in the same dosing as the ARTs, the same frequency, sorry, as the ARTs, or we are giving calcium or something that is not harmful, that the body needs is a supplement, and it can get over the counter, then you already have those things before the client walks in for the strategy work plan.
Okay.
Yeah. So once you do that, you can schedule a new appointment for adherence readiness for the next time the client comes back, whether in 1 week or 2 weeks. Depends on the duration of time you want the clients to practice how to take the medication. And when the client comes back the next time, you go through the same first form we went through for adherence readiness and see if the client is ready at this time or the client has more confidence. If you think the client does not have more confidence, you try simulating again. It doesn't make any sense giving the medication to clients that will not take them or will not be adherent and now have more problems in the future. So even if you are not giving the ART at that time, you want to try to make sure the client is ready at the earliest possible time. Once you are done, this is where the job for the counselor ends for getting the client ready to be on ART. And then we go back to the care registrations and initial evaluation. For any clients that comes in, it is exactly the same form and the same process for the adherence, readiness, and the strategy work plan. So we have referrals for TB and other referrals. We are not going to look at those referrals, but when you go to view TB care referral, you will see the list of everybody who do not have HIV, but have been diagnosed with TB, either presumptive or there's a diagnosis, and they are referred for care registration. You register TB. The forms generated will be different from someone who has HIV. It will just be TB specific forms. And until they become HIV positive, they will not have HIV care cards as part of their forms. So we'll look at TB referrals and TB treatments when we go to clinical management. Other care referrals also. So if people with other STIs and do not have HIV, people with viral hepatitis, and are referred, people that are referred to be on PrEP or PEP because you want to monitor them in the clinic when you prescribe those medications, or because the health center will not prescribe, right? And they're coming to the clinic to get the prescription for PrEP or PEP. You'll see them under other care referrals. Once we register these ones, we are going to look at this under prevention and control. When you register these clients, the forms generated will just be to document all of their labs, maybe their renal functions and the rest, and then the prescription that was given to them. Once we do an initial evaluation, we are going to now schedule a clinical management appointment for a client, but we're not looking at that today. We are going to review what we have done so far because a lot of people came in now. So I'm going to go over everything I said from the beginning, and I'm going to go over it in order. Since we already know how it ends, we will understand the beginning better. When you log in,
Mildred, as you were saying, some persons now coming, so you're gonna go over. Just I don't know if you could go a little bit slower, okay, so that we can make sure we get the steps. Thank you.
All right, I'll do that. So when you log in, once you are assigned the screenings and management role, you'll be welcome to this page. On the left side of your page is a pages menu. If you expand that menu, you will see a list of submenus that will be visible only based on the permissions that you are assigned. So if your job function requires you to do certain things and you can't find it on your list of pages, it means that the permission was not granted to you by your supervisor, and you need to call them to update your permissions. For today, the focus is on care registrations and initial evaluation, and on psychosocial support or adherence counseling. So these two submenus should be seen on the pages of those whose job function requires them to fill in information about this. If you don't have it, your permissions will need to be updated. So when you go to care registrations and initial evaluation, you will find a list of functionalities. We have a link to view all HIV care referrals, a link to view all TB care referrals, a link to view other care referrals. So the first three is to see the list if anybody has been referred, and not yet in care. If we click on View HIV Care Referrals, we will see the list of all of those who have been referred. We'll get the dates they were referred, the unique ID, their names, the dates they were born, their sex, the person who referred them, and the category of the client. There are 4 categories: adults, pregnant, adolescent, and pediatric. Only the pediatric client has a totally different form generated for clinical management. The rest of the clients have similar forms generated for clinical management. The reason for the category is for you to be able to prioritize or see which part of the system to go next. So if it's an adult, you are going to adult. And when you refer into care, you're going to adult initial evaluation. And if it's pediatric, you're going to pediatric initial evaluation. The next link is to view TB care referrals. So if you have anybody who has TB and was referred from a clinic for care management for TB, you will find the person on the list. So it means that anybody on this list, it is assumed that the testing site did the right thing. The person was negative or non-reactive to a HIV screening, but the person has TB and the person has been referred for TB care management. The other one is to view other care referrals. So if somebody has syphilis or other STIs and doesn't have HIV, or has viral hepatitis but no HIV, no TB, or the person has been referred as part of prevention and control to be placed on PrEP or PEP, then the person is going to be under other care referrals. So anybody you see under other care referrals, the person is assumed that at the time of referral, the person has no HIV, no TB, but has other sexually transmitted infections or viral hepatitis. So once you view the list and you have an idea of the people who have been referred and not yet in care, we want to look at HIV care registrations today. The next link you go to is HIV care registration. If the client comes in, the client is in front of you, you ask for the unique ID. The ID is on this list of the list of people referred. You can copy the unique ID. Let me take that of a pediatric client. And then you go to HIV care registration. And then you put in the ID and it gives you a registration form that the system generates with all of the names, the category, the person who referred, and the date of referral. So this client was referred on the 1st day of February in 2022, and the client is available today to be registered into care. So only the surveillance reporting will show the difference between, the time difference from referral to registration into care for reporting purpose. And so we're going to register this. So once you register, you get this message that the form has been used. So it means you can never register any clients twice. And once you register a client into care, you go back to the list of referrals, you won't find that client on the list anymore. So anybody on this list is not yet in care. So once you have registered the client into care, the person we registered is a pediatric client. So we are going to go to pediatric initial and clinical evaluation. So after the HIV care registration, we have TB care registration. You use this only when you are registering into care someone who has just standalone TB, no HIV, no STIs, just TB. Initial and clinical evaluation is used for adults, adolescents, pregnant. Pediatric initial evaluation is used for a pediatric client. So we just registered a pediatric client into care, and we are going to do the initial evaluation for that pediatric client. And I'll click on Get Form. So now this form, we can say it is totally different from the initial evaluation of the adult clients we looked at earlier. The enrollment form 1-2 is asking for the maternal treatment during pregnancy. If this is a child who was exposed, and intrapartum PMTCT treatment, if it was a client that was positive but only showed up during labor, and there was any treatment during labor until the placenta, you fill in this. If the child was exposed and there is a neonatal PMTCT ARV exposure, you fill in this. And the age of the child at enrollment is 11. This child is an index child of parents that are negative, so she got her HIV from a different source. The name of primary caregiver, let's put any name, and we'll say this is the name of her mother. The name of secondary caregiver, we'll put any name, the name of her dad. So let's say her parents are primary and secondary. The address of the caregiver, so let's say they live at Success Street. The address of secondary caregiver, we'll say he lives somewhere different. He lives at okay. So did the caregiver agree to home visits? Let's say she said no. So we're talking about the primary caregiver going forward. The telephone number of the caregiver, she doesn't want to give it out, and so we do not have it. The mode of transmission, if positive. This child is positive, but it was not a mother-to-child transmission. We don't know how the child got it, but the child came in as a victim of rape, and the child was sexually active since she was 9. And we're talking about Grace from case 3 of our case scenario. The mode of delivery when she was born. So you can fill in this information if this is an exposed infant who is positive and has been registered into care. If it is a child that got positive and they're still trying to figure out where the child got it from, the parents are not positive, then you do not need to fill in this information, except you have her antenatal card of when she was born, and you can see her gestation age at the time she was born, the duration of membrane rupture, the mode of delivery when she was born. You can fill in this information, but the mode of transmission is not mother to child, so you do not fill in this. The date of final HIV diagnosis was on the 1st day of February, based on her referral, 2022. The type of test that was done, let's say it was an antibody test, and the date of enrollment into care is today. The date started ARV, she has not started yet, so there is no date. The date of status disclosure to child. So if the child is aware of what is wrong with her, that she is HIV positive and the child has been told, you put in the date. If the child has not been told, then there is no date to put in. So let's assume that the mother has told the child today, and that is why they're coming to the clinic. So the child's mother is alive, and the father, let's say, has been tested and is negative. We want to get the address of the father, which is a secondary caregiver, so his address is at Determination Street. And his telephone number, if we want to put it down. So let's say they gave us the telephone number. And then you save this form. So we have enrolled Grace. We've collected Grace enrollment information, and it's now time for us to do her clinical staging. So she has mild symptoms. She's in stage 2, and stage 2 here is on the 8th of February, 2022. Now we want to get her immunization card and see all the immunizations that she has taken as a child, and you want to fill them in one after the other. So if Grace has been vaccinated, taking all her child vaccines, you put them all in so you can have her vaccination history on her page. So let's say when she was born, she took, we're putting this date today, February 2022. They gave her her Hiv vaccine, her first dose, the day she was born. And Grace was born, she's 11 years old. She was born in 2011. So let's say she was born on the first day of January 2011. This might be the wrong date, but we'll just assume that this is the date of birth. She was vaccinated at 2:33 p.m. and she got this vaccine with this batch number, and the place she was vaccinated is at the General Hospital. And the person who vaccinated her is called Moses James. And then we'll save this. So you enter the second dose, the third dose, the other vaccines that she has taken. So you get the idea of filling in vaccines. The type of vaccination drop-down menu is populated based on what you entered during system configuration. So this is not a predefined list, it's a list you define yourself in the country. So the viral load now, but back to the immunization, if you are giving her any vaccine right now, you are going to put in the vaccine here, and the date is going to be today's date. So the viral load now is if you are requesting for a viral load test, or you're sending them to the lab for viral load, or you're taking the sample, you want to put in the dates the sample was drawn here. If you are not going to take the sample today, you can leave it blank. And when the result returns, you want to put in the date the sample was taken and then the value of the viral load. So let's say our viral load is very high. She has 50,000 copies per mil. And we'll save this. And then you want to also get her Cd4 values. So you can update this in the event that you do not have the value for the viral load. You just put in the date the sample was drawn. When you come back here, you put in the value and submit again to update. Now the Cd4 values. So we are coming for the date of first Cd4 test. If she is having a Cd4 test or sample taken for test today, we are going to put in the date today. And then you can leave it blank when there is no value, and we'll submit this, and we'll come back for the value. Let's say later in the afternoon it returned. We want to put in the value for this date, and the value was, let's say our value was 250 or 220. And then, so for this value, she's not going to be in stage 2. So let's make her 400. And then we'll submit. So now we have updated her value because we now have the value. If this value were to be less than 350, you'll fill in the date here and the value 350 for the date of first Cd4 count less than 350. If it was less than 200, you fill in the date and the value here for when she got a less than 200 value. But for now, she has just 400. That's the value we have, and this is the date. And so we don't have values for these ones, so we don't fill in anything here. And we are done with the pediatric initial evaluation. Is this clear now? Should I go on?
Yes, please, it's clear for me.
So the next thing we are going to look at is, let's look at the care registration list. We have registered people for HIV care registration. You want to see the list of people in care. You go to HIV care registration list. It will give you the unique ID, the dates they were registered into care, the person who registered them into care, and the category of the clients. Let us register an exposed infant into care and do the exposed infant evaluation. For this, you come back to care registration and initial evaluation, and you look for exposed infant care registration. You're going to have the exposed infant registration form. The date of record is today's date. The first name of the infant, we'll say it's Moses. Moses has a middle name called John, and Moses has a last name called Eric. Moses was born on the 3rd day of January 2022. And the mother's unique ID, we will give any unique ID, but normally the unique ID of the mother will already be on the system if this is a mother who is in care. So let's say JB0145. And the infant's ID. You want to come up with an algorithm for giving infant unique ID. If this client's record, the birth record is on the system from the antenatal clinic, you can use the baby code as the infant's ID. If the client's record is not on the antenatal system and you are going to make up a unique ID, you might want to put in the mother's ID and a suffix to the mother's ID so that it will be easy to remember the child's ID whenever the mother comes in. So we made the mother's ID JB0145DOE. And then let me say Moses is, I'll put Moses as the last name. So you come up with your algorithm the way that will make it easy for you to remember, or for the mother to remember both her ID and the child's ID. So you might want to use the mother's unique ID with the child's first name, or whatever you choose. But choose something that makes everything easy. So the health district here now is, I'll choose any health district and the parish. The sex of the child is male. The birth weight of the child. So the reason this form is not populated automatically is to allow for children to be registered even if they don't have an antenatal record for that child on the system. So if we are going to make it very strict to make sure that any child who is registered for exposed infant has an antenatal record, then all of these values will be populated automatically. And that might be difficult in the event where the antenatal record for this child, when the mother was pregnant, is not on the system. So we want to make this as easy as possible. So you will enter the weight of the child when the child was born, regardless of whether the child's antenatal record was on the system. So when this child was born, the child was 7.4 pounds. The system will convert this to kilogram once you move out of the field. The length of this child at birth was 48 centimeters. The system will convert it to meters. And then you want to select the type of feeding that the child had. So, or the child is having now. So the child is on replacement feeds. And we're going to register this child. Once you register and expose the infant, you are going to come back here, and then you are going to come back to care registration and initial evaluation, and you go to exposed infant evaluation. So the order is you register into care regardless of the population. Just select if it's adult registration, you do HIV care registration. If it's pediatric, HIV care registration. And then if the client is not pediatric, you use initial clinical evaluation. If the child is pediatric, you use pediatric initial and clinical evaluation. If the child is exposed, you use exposed infant initial and clinical evaluation. So that is the order. So we have the unique ID that we gave this child when we registered this exposed infant, JB0145DOE, Moses, and get the form. The exposed infant enrollment form is exactly the same as the pediatric enrollment form. So you are going to look at the maternal treatment during pregnancy. So for the doctors on the call, what treatments do you normally give the mothers for PMTCT? This?
Regimen containing azidopyridine.
You said?
A regimen containing azidopyridine. I think it's the one above it.
This?
No, AZT3.
CTC, EFB. Okay. Okay. Yep. So what do you give mothers? Let's assume that this mother did not go through PMTCT. She came into labor and she was given injected during labor. What do you give? The same or different?
Yeah. Same. That's the same.
The same. Okay, so this woman was exposed to PMTCT, so she is not going to, let's assume that there was none of this for the case of this scenario. And then the child was born, and the child would be on AZT or AZT plus a single dose of nevirapine, right? So which will you give in the event that during the pregnancy, the mother was in PMTCT, right? So which of these two will you give the exposed infant now?
Yes.
Just AZT.
Yes.
Okay. And now the child now is 6 weeks old. You are going to fill in the name of the primary caregiver, which is the child's mother. The name is Jane. And the secondary caregiver, which is Jane's mom. So let's say Jane's mom's name is Mary. The address of, so you have the last name, you can make up one. So this is Jane Doe, and her mother is Mary Doe. And the address of the primary caregiver is going to be Kingston, and the mother lives in the same place. And then, did the caregiver agree to home visit? No. So the mode of transmission, if positive. So let's say this child is not positive yet. So we're not filling this in. The child was born through a non-elective cesarean section. The gestation age when the child was born was 39 weeks. The duration of membrane rupture, let's look at 6 hours and 45 minutes. And then the date of final HIV diagnosis, if this is an exposed infant that has become positive. So whenever the exposed infant becomes positive, you come back to the enrollment form to update that now this is a mother-to-child transmission. This is the date of the final diagnosis. And then the type of test that was done to give that diagnosis for the final HIV. And also the date of enrollment into care now no longer has an exposed infant, but enrollment as an HIV positive child. So everything after this mode of transmission going down should be filled if the child ends up being positive. And because this child is an exposed infant, we will save. We can come back to this form at any time to update the information whenever the child becomes positive. And if the child does not become positive later in life and the last test is negative, then the child just remains exposed and needs care. If the child ever becomes positive, you go through the normal general population when you do the 2-3 year screening, and then refer the clients for care registration and management. So we're going to look at that. Maybe I'll go through that tomorrow before we do the clinical management. So the exposed infant screenings now. So the system is going to automatically look at the date of the first test, second test, versus the date it is supposed to be done. So the system is not going to enforce a particular time period. So if you're supposed to do the first test at birth or within the first 2 days of life, you know the regulation in the country, you come here and record the first test on the day it is done. So this child is 6 weeks old and is getting the first test at 6 weeks. So the system is going to, the surveillance is going to do the automatic reporting of the time frame when testing is done. So if you are testing at the wrong time, reporting will pick it up and we'll see if this is one of the things that needs to be improved in the future. So the type of test now is a PCR test and the result has returned negative. So you save this. So whenever it is time for another screening for this exposed infant, you come here to fill in test 2 because you see test 1 already has values in them. You fill in test 2. Whenever you do a third test, the fourth test, or after the child is already 2 years old, or over 18 months, you do the fourth test. So you decide what timing within the countries you do the test of the exposed infants. Immunization is exactly the same. You fill in the records based on your immunization schedule. I'm going to put a table above here that will give you the schedule that the immunization manager would have entered into the system, so that when you fill in or you want to give immunization appointments, you will know what time to ask them to come for the different vaccines that the child needs to take. So once you are giving a vaccine to this child, you are going to record the vaccine you are giving to the child, just the same way we did previously, the type of vaccine and the dose or the series. If it's a one-time vaccine, you put in there as one time, and then the date, the time, the manufacturer, batch number, the place you are vaccinating from, and the name of the person giving the vaccine, and you save. And then you are done with the exposed infant. Every time the exposed infant has an appointment, you are always going to come back to exposed infant evaluation. The exposed infants will never have a care card outside of this, only except when the exposed infant becomes positive. Okay, so someone said I should put the age when it was done. I felt it was redundant. It was redundant because the system will automatically calculate it at the back end based on the date of test. So since the system has the date of birth and you put in the date of test, that calculation will go there. So what I will do instead is to put a form that shows you the date at the time of testing when you want to just print out the test record for the child. So I'll put the extra tab here to give you age of child at test. So there'll be no need to put the any field to ask you to put in the age. Since the system already knows the age of the child and you put in the date of the test, it will calculate it automatically. Put it there. So does that answer your question, Jennifer? Okay. So this is all for the exposed infants. So for exposed infants again, you will come to care registration and initial evaluation. You will click on exposed infant care registration, and then you go to exposed infant evaluation. So for exposed infant, these are the only two functionalities you are going to have. At every appointment, you are going to use exposed infant evaluation until the exposed infants become positive. Then the exposed infant will be registered into care as a pediatric client. This is all our agenda for today. So I will take questions and clarifications. I will create new case scenarios for this purpose and then put them up before tomorrow's session. And then we're going to go through all of this tomorrow and have the hands-on session. Any questions now? Should I repeat everything all over again for those who, if it's not clear?
I must say, Mildred, it's a lot of information, so it will take some time to register. So maybe you could just go over the steps one more time, if it's not a problem.
No, it's not a problem.
I agree. Let's go over the steps one more time, please.
Okay, so let's make it clearer. When a client is tested at the various testing sites around the country, the client will be referred electronically for care registration. Once a client is referred at the STI clinic where care registrations are done,
Mildred, wait first. Before you go there, we are looking at care registration, right? But if I go on to the system, like somebody shows up at the clinic today, okay, for care, do I go straight to the care registration, or I go to the referral first to see who are referral and if they have a unique ID number?
Yes. So what you do when someone walks in, so that you don't try to get a form and don't find it, is to come back to your care registration and initial evaluation and view HIV care referral. So,
okay.
So you will see the list of all those who are referred from the various testing sites around the country, but are not yet in care. So you ask them for the unique ID. You will see on this list, you will find that unique ID. I'm going to put a search bar here after this session, so you can just search in case you have a very long list. So you put in the unique ID that the client gives you, the unique ID that was used to do all of the screenings at the testing sites is the same unique ID that the client will use all through the system. So if the unique ID is not on this list, you want to check the care registration list and see all the clients that are in care. So we'll go to HIV care registration list. If the unique ID is not on this list, it means that the client was not referred from the health center. Okay, we have a question from Dr. Peters. You saw the PDF options. Yes, it's for in the event you want to print out anything in PDF form, PDF. If you want to export to Excel or CSV for further analysis, you click on CSV or Excel. If you just want to print, you can click on print. So that is the function of those buttons. Okay, now, so does this answer the question?
Yes, ma'am.
Okay, so when you see, when a client walks in now and you view the referral list, if the client is not on this list, you want to look at the list of those in care. If the client is not on that list, then the client was not referred on the system. You might want to ask the client for their health center and call them to do the referral. Or if you have the referral permission, you want to go to referrals and refer new HIV case for care registration and management, enter that unique ID they've given you and the date, the category, and do the referral so that the system will allow you to register the client into care. If you try to refer the client again and the system does not find the record and is not allowing you to refer, it means that the client's record is not on the system. So maybe all the records were paper-based. And so at that point, it's either you want to create an account for the client and go through all of the general population screenings process and take in the results to enter into the system so the clients can have an account on the system before you get the referral, or you want to go paper-based and do that process later when the clients leave. So the process is you come to care registrations and initial evaluation. You view the referrals list for HIV. So we are dealing with just HIV referrals today. If you want to register for TB care or for other care that is not HIV and TB, you put other. So you view the referrals for HIV, you look at the names on the list or the unique IDs on the list and see if the unique ID matches a unique ID of the client in front of you who has walked in. If it is not there, you want to find out if the system has that client on the registration list. Maybe the client has been registered somewhere else previously. You'll find on the registration list. So this list will give you a list of registration throughout the country. It doesn't segregate by site. So you'll see if the client is registered anywhere, you will see the list of registration so that you can know what the problem is when you don't find a record for the client. And if the client is not on this list, the client is not on the referral list, the client does not have an account on the system, it means that the client doesn't have a record on the system. So if you have the general population screenings permission there, you can go ahead to create the account, to put in all the values for the screenings, to refer the clients and register into care on the system. If you do not have those paper records and you want to contact the health center to do it, you can do that. But if you don't want to waste the client's time, you want to go ahead to do your today's business, you can reverse to using paper and sort that out later when the account is created and all of the values are entered in the system. So once you view referrals, the client is on the list, you are going to go straight to the care registration. If you are registering for HIV, you use HIV care registration. For tuberculosis, TB care registration. So any of the two you are using, HIV or TB. Now, what I'm going to show you tomorrow is the other care referrals is going to go as part of HIV care registration, because you are going to be giving similar medications and similar follow-up if somebody is on PrEP or PEP for other for prevention reasons, or if the person is there for other STIs. So we'll look at that in details. I don't want to complicate today more than it is. So we have HIV care registration, and you use this to enter the unique ID of somebody who is on the referral list and who is not yet in care. And then you get registration form, and then you put in the dates, submit, and next thing you do, if that client belongs to the adult, pregnant, or adolescent category, you are going next to initial and clinical evaluation. If the client is a pediatric client, after registration, you go to pediatric initial and clinical evaluation. If the client is not on the referral list and is an exposed infant, you are not going to use any of the referrals. You just come straight to exposed infant care registration and then exposed infant evaluation. Once you do the evaluation of any of the clients, you are going to send the client straight to the adherence counselor, who is going to go to their permission, psychosocial support or adherence counseling, schedule a counseling appointment, and there are 3 types of it: for adherence readiness assessment, for adherence strategy work plan, and for follow-up assessment. So today we focused on adherence readiness assessment and adherence strategy work plans. Once you schedule the clients, you'll come back to the psychosocial support, and then you will start the counseling encounter. The system will generate form for the client based on the type of counseling section it is. If it is an adherence readiness assessment and the client is ready to be on ART, and you click on ready, then you can send the client for clinical management appointments, where the vitals will be taken and clinical management starts. We'll look at that next week. If the client is not ready, you want to move straight to an adherence strategy work plan, where you give the client vitamins or supplements with the same frequency as the intended ARTs that the client is going to be on, to see if the client can build the confidence to take the medications every day or can adhere to those trial simulation, and maybe 1 or 2 weeks. And when the client comes back, you do the readiness assessment again to see if the client is now ready. And then you send the client now for the clinical management, where the prescriptions will be given. The first time, the client can still go for clinical management, but the clinical care coordinator will see on the care card that the client is not ready for ART, and the client is not going to be prescribed one. Should I repeat anything again? So I will, after this session, draw a flow chart of the process. So maybe to make it easy to have a flow chart of the process.
Yeah, I think that would help.
Yes, so after this session, I will draw a flow chart and put it on the page, or just email it, and you will all have the process. Then I will get the case scenarios for today's session, and tomorrow we will do hands-on to be able to understand it properly.
Okay, thanks. That would be good.
Yeah. So I can still stay back and repeat again if anybody wants to stay. Okay, so I will repeat it again for the last time before we close. We still have enough time. If nobody minds, you can stay on. If you feel you are comfortable, you can go, you can log out. But before you log out, can you please put your full name in the chats, and if you're more than one, you can put the names of everybody in your group if you are leaving now. If not, we'll take introduction at the end. So I will repeat it one more time, and then we'll do introductions for attendance. So the first time you come to your system on a clinic day, you will log in to patient management and reporting system. The login process uses both authentication to identify who you are and authorization to see where you have permissions granted. So once you log in, the system checks your permissions. If you are a pharmacist, you will have this blue box on your page that will allow you to change the pharmacy you are assigned in the event that you are going to be dispensing from a different pharmacy that is not the same as the pharmacy that you are assigned. On the left side of the page is the pages menu. When you expand that menu, you will find a list of submenus that will be populated depending on the permissions that you are assigned. So if you are not assigned a certain permission, you won't find that link to the functionalities of that permission on your page. Today's session is about care registration and initial evaluation. Then we are also looking at adherence readiness, psychosocial support, or adherence counseling. For care registrations and initial evaluation, we have links to view referrals, links to register the referred client into care, and then the links to go on with an initial clinical evaluation. We also have links to look at the list of those who are in care. When a client walks in for the first time to be registered into care, if the client was referred for HIV care management, you are going to view HIV care referral. On this list, you will find all the clients that were referred and are not yet in care. When a client is not on this list, it will be based on one of three reasons. Either the client has been registered into care at a different site or by somebody else, or the client was not referred from the testing site, or the client has no account on the system. So the first thing you want to do is look at this list to make sure that the client is on the list so that you don't waste your time filling forms and then the system gives you an error that it doesn't exist. So if the client is not on this list, you want to find out why. You go back to the list of those who are in care. And at this point, you are going to look at HIV Care Registration list. If the unique ID does not exist here, you want to go to referrals if you have that permission to refer the client, or you want to ask the client for the site that referred them and call the site to see if they will refer the client electronically. So you either want to go to referrals if you have that permission and then refer new HIV case for care registration and management. If you try this and it does not find a unique ID, it means that the client does not have a record on the system. So you might want to start general population counseling and testing and go through the process of creating the accounts, entering the screening results, refer the client before you will find that name on the list of clients who are referred for care registration. In that event, you don't want to waste the client's time, so you might revert to paper and sort it out later when the client leaves. So we'll assume that all the sites are using the system, they refer, nobody forgets, the name is going to be on the referral list. You will take one of the unique IDs here. So you're only going to register client into care when the client is in front of you. It will make things easier that way. So you don't register people into care when they're not there. And the system will look at it like a lot of your clients are not in care, or they're in care, but they are lost to follow up or something. So don't register if the client is not there. So don't come to the list in the morning and see the list of people and you just want to register all of them in care. So whenever they come, they're already registered. Register them as they come. So when the person is there, you look at the list, the unique IDs on the list, you either want to copy it here or you go to HIV Care Registration, because we are dealing with HIV alone today. You click on HIV Care Registration. You enter that unique ID. You click on Get Registration Form, and then you get the form to register the client. So the unique identifier is going to be the unique ID that the testing site used for the client. So the testing sites will have discussed, or the country would have discussed what you use as unique ID, either the hospital registration number, the driver's license, national ID number, MPID, anything at all, or you generate one. But the unique ID is given at the time of account creation at the testing site. So it's not going to be at the management clinic. So at the care facility now, you really do not have so much business with generating unique IDs, because whoever creates the account at the level of testing would have generated the unique ID, and the client will come in with a unique ID and you will use that. So the form is here for registration of clients into care. All you need to do is enter the dates. The form has all the values for the unique ID that you entered, and you click on register. Now this client is now registered into care. You get the success message. The form is a one-time form, so the system takes away the form as soon as you're done. So you can't register anybody twice. Once you do this registration, the category of clients was adult. Any category of clients that is not pediatric, you come to initial and clinical evaluation. You enter that unique ID to get the forms that the system has generated. On this form, you have 5 tabs: 1 to fill in enrollment information, 1 to fill in the baseline information, the other for the clinical staging, another for Cd4 information, and the last one for the viral load information. You fill in as much information as you have on that first visit, and subsequent visits, you can come back to this evaluation form and update anything that was missing previously. So this client was confirmed positive. So you would have found it on the list of the dates when you registered that the client was confirmed positive on the, let's say, 31st of January, 2022. So why this is important for you to enter this information is because is a reporting indicator. You want to see the distance between confirmed positive and enrollment into care. So the date of enrollment is 8th of February, 2022. And the age at enrollment is already on the form, which is 40. If this client is somebody who has been on risk reduction plan and has been on PEP or on PrEP, or the client was an exposed infant 40 years ago when he was born and had already had an ARV exposure, you are going to select the previous acts here: the regimen, the dates the person started, and the care entry point. But if the person has never been on ART, you are going to click on submit. You get a success message. You are done with this form. You go next to baseline information. The baseline information, you want to put the date started ART. So if the client is going to be on ART today, or you are filling this form at the end of the client's clinical management session where prescription is given for ART, today is going to be the first day. You put in the date. But if not, leave it blank. Go to the initial weight. This client is 250 pounds. And the system automatically converts this to kilograms. Is this client symptomatic? What clinical stage is this client in the first time the client was registered into care? So maybe the client was just a contact and is asymptomatic and is in stage 1. Does this client have a treatment supporter or somebody that can come to pick up prescription and medication for the client if the client cannot do that? you put in the name of the person here, so that if you want to, if there's a strict rule not to give out medications to somebody who is not on that list, you can put as many people on the list. The box looks like it's one, but you can put more than one name, so that any of the people who come to pick up medication on behalf of these clients, the name is already on the list, and so you can verify and give them. So at every visit, the clients can update these names if somebody is no longer on the list of treatment supporter, or the person wants to add new names. If you fill in any name here, you want to put the relationship of that person to the client. If the client has a home-based care provider, you put in the name of the person. And if the client has drug allergies, you fill in the allergies. And then submit. Once you are done, the values are retained for when you update. You can only fill in the fields you are updating and you save. The next thing is to go to the clinical staging. For the clinical staging, you want to look whether the client is asymptomatic, has mild symptoms, advanced symptoms, or severe symptoms. So it's going to be in stage 1, 2, 3, 4. I will update this table after the meeting because it looks like I saw a new table from WHO this morning. But you're only going to fill in the dates for the first WHO clinical stage 1 or 2 diagnosis. So let's say he is in stage 1, and today is the date. So either stage 1 or 2, you fill in the date here. If the client is in stage 3, or whenever the client gets to stage 3, you come back to his clinical evaluation or initial evaluation form and fill in the date when the client first got to the stage 3 diagnosis. And when the client ever gets to stage 4, you come here to put in the date. But for now, we only have a stage 1 diagnosis, and the date is today. If you are going to take samples for CD4 at this first visit, you will fill in the dates here. If you are filling in this form when you already have the results returned, you will fill in the value. If not, just put in the date of the sample. So when the results return, you can just update the value. So put in the date for the date of first CD4, and it's updated successfully. Whenever the result returns, you come back here to just put in the value. You do exactly the same thing for viral loads. You put in the date that you are requesting the test, what the sample is taken, and when the results return, you update the form. So we'll say this sample was taken today, and the result has returned today. And the result is 10,000 copies. And then we'll submit this. So you are done with the initial evaluation for these adult clients.
One question, Mildred.
Yeah.
The viral load on the Cd4.
Yeah.
If you have the value at the same day, you said you can go back and always fit it in.
Yes.
Now I notice data first viral load. For us, we do viral load like twice per year. CD4 is 3 times per year. So when this form finish, will the system generate a new form?
No, on the clinical management, there is now new forms at every visit whenever you have a new CD4. This form is for initial evaluation, where you put in just initial values or critical values.
Okay, thank you. Just checking.
Okay. So when we get to clinical management, you will see CD4 and viral load record forms for every visit.
Thank you. Mildred, for the dates, here in Antigua, we do not take the samples of the clinic.
Okay.
So we will have a request date. Well, we have a book that I created here where we have the request date when we send the sample, the patient to have the sample, the test done, but then sometimes 2 months, and then the client will go to the lab. So I think for us, we may have to leave that blank, because the date that we would have put there in our context here, see, now we do not take samples at the clinic, will be the request date. So only if we have 3 where we have request date, sample date, and result.
No, but the thing is,
so maybe you'd want to. So could we include the date of request?
No, that might be redundant. So what you do in this case is that you put in the date you request and save. If they decide to go for the test 4 months later, when the result is returned, you always have the date of the test on the results, right? You update that date. But at this time, the system already has a trail of when you requested. So it's not going to be a health system failure now if you're looking at the analysis of why things are not done properly. It will be that it was requested, but the client now is not going to be a client-related problem. Decided to do it 6 months or 10 months later. Right? But once you put in the first date and you save, the system always have a log of the other time. If you want to feel comfortable by seeing the date of request, I can put it in there. But it doesn't really matter, because whatever you're trying to avoid will still be avoided.
Because at least I like the fact when you're doing the adherence counseling that you can always refer to. That is why we created the book with regards to the requests, especially for persons who are non-adherent. They don't go to the lab on time. And then when they return to clinic, within 3 months, we still don't have blood results for them. So the request date and the date, and then another thing, we will have to follow up with the lab too, because sometimes the lab don't even write in the result date. So what I will do is look at when they stamp it at billings and, do an average. But with the request date, I like that. Thank you.
Okay, so what I'll do here, I'll change this to date of request, and then when you put in the results, I'll put date of results.
Yes.
Okay.
Nice.
So I'll update that before tomorrow's session. So any more questions? Okay, if there's no more.
No questions.
Okay. So if there is no more, this is the process you go through. Once you do the care registration for a pediatric client, you are going to come to pediatric initial and clinical evaluation. If you have registered an exposed infant, you come to exposed infant evaluation. The forms for adults, for pediatric, for exposed infants are not the same. The exposed infants and pediatric clients have similar forms, except for the exposed infant screenings form. If we look at let me get the ID of somebody we have already filled in. If you come into the exposed infants or the pediatric initial evaluation, and you enter the ID of a client who has been registered into care, you will find the pediatric enrollment information form. On this form, you are to select the maternal treatments during pregnancy, the intrapartum PMTCT treatment, the neonatal ARV exposure, the age of the child at enrollment, and then you enter the names of the primary caregiver, secondary caregiver, and the addresses, and you answer the other questions going down. There are questions here that are specific to a child who has become positive. But if you are filling this form, not for a pediatric client, but for an exposed infant who is not yet positive, you will ignore all of the field down here. And then you come to the clinical staging. And then you fill in the dates for the first stage 1 diagnosis. If the client is in stage 2, the same dates. The client is in stage 3, you put in the date for the first stage 3 diagnosis. And if the client is in stage 4, the date of the first stage 4 diagnosis. You'll get the immunization record of the child. If the child was not an exposed infant and the child is just a pediatric case that became positive but not through exposure, you fill in the immunization records of the clients and fill in the immunization of new vaccines that you give the clients going forward. The same thing with the viral load, just as we discussed for the adults and the Cd4. So for the exposed infants, they have this form, then they have a test form when you record the exposed infant testing, and then they have immunization. The exposed infants do not have clinical stage, viral load, or Cd4. Okay, so this is a summary of registration and initial evaluation. Is it clearer now?
Yes, it is. Thank you.
Okay.
Yes, it is.
So I will make the updates for all the recommendations before tomorrow's session. Then we'll go through it. I'll create a flow chart and send the email and a case scenario that we will have hands-on tomorrow. So tomorrow we will repeat all of this and then we'll go into the hands-on session.
A question here, I guess not just for you, Mildred, but others in the group. In terms of completing all these forms, how do you find completing the forms? Is it while the client is there, or you collect the information and then enter them at a later date? Because I'm trying to go through our system here to see which would be the best route for us. Because sometimes to complete all these forms with the client there may take a little while, especially if you're just getting used to the system and you don't want to have the client there for so long. I don't know how the others in the other countries do it, whether they collect the information and then enter them at a later date. I'm not sure how it works for them.
We had our training, well, Mildred did an initial training with us some years ago, but unfortunately for me, I never really had the chance to practice because we was to change location and our internet and the system was not set up at the new location. So we are not practicing. But I'm hoping that after this training, I will be able to. I think because like most persons will come to clinic on a clinic day, I am thinking that maybe I can collect my information as usual on a piece of what we used to do before, paper, and then maybe I can sort it out after. There are cases where in my situation where somebody might refer the client to me, like they have a positive HIV test. It is not doctor's day. I think in that case, I could use that opportunity to register them. So I don't know, maybe you can try that, or like if it's doctor's day and you do not have a whole lot of clients waiting, you could probably try register them on the system and maybe follow out as you go along.
Yes, that is what we do here in Antigua. You can register the client and then give them the appointment date for when the doctor will be seeing them. Also, because of unreliable internet, you have to do the paperwork and then enter, because internet has not been reliable here. But we have done some face-to-face entry in the system for case base. So according to what presents, that is how you have to work. You cannot say internet because, like I said, it may not be reliable. So you do face-to-face and you do pre, especially with the appointments. If you have a confirmation, then you can register that person and give them the appointment date for when they will be seeing the doctor. If internet is unreliable, then you can do your paperwork and then you enter into the system. The antenatals here, they have it printed and also at the clinic, the information, and so it's done manually and then entered into the system because your clinic may not have a computer system and internet.
Exactly. Right.
So for
Right.
persons like that, you have to have it printed. And then when you get to a computer system, maybe in another office, then you do the entering. So it's like whatever your situation is in country, then you come up with your plan to make sure that you utilize the system. And I think that is why a few islands, didn't use the system because of those infrastructure that we hadn't in place. But so that's what we do here. But I have a question, Mildred. With the pediatric enrollment information, you have mother's name and the treatment that the mother is on.
Yeah.
What if we have, like I had mentioned the last time about babies who were abandoned? And as long as you have a newborn or a child who is abandoned, then you have to take them through the basics. They have to do all the tasks. So that child automatically goes on the exposed infant. And so you will take sample and eventually that child may come out positive, but we have no information with regards to who the mother is or who the parents are. And you have maternal treatment during pregnancy. So how do we account for that? Because we do not know anything about her or where the child was born or anything like that.
Yeah, so in events like that, you leave those fields blank.
Okay.
Because you do not have information for them. But somebody is going to be the primary caregiver for an abandoned child. So if the child is with social worker or there's somewhere, somebody is responsible for the child. That person is going to be primary. If there are more than one people and they change them, you put primary and secondary, or you put the names of the supervisors of whatever social welfare office that handles the child case. If in the future the child gets adopted, then you can change the names of the primary and secondary caregiver. So this form for pediatric enrollment is the same as the form for exposed infant enrollment. You just fill in the information you have and leave the information that is not available.
So you have caregiver information, but no information with regards to biological parents. Got you.
Yes, so the caregiver now is going to be whoever, whether the mom or the dad. Yeah, so the caregivers will be either the mom, the dad, anybody who is going to take care of the child as a primary caregiver. If it's the mother is primary. If the father is also going to be there, secondary. If the grandmom or somebody else, secondary. Or if the grandmom is the person who has custody of the child and takes care of the child, is the primary caregiver. If the father is the person who takes care of the child or the child lives with the father is the primary caregiver. So once you have entered primary or secondary, at the bottom here, it asks for if the client, if the mother of the child is alive. Now remember that during the registration, it asks for the unique ID of the mother if the mother is positive. But in the event where the mother is not positive, you are going to enter just the names as caregivers, not the names of the mother or the father. So I don't know if you want this to be changed to be name of mother or name of father. But I know that in many situations, the caregiver might not just be the mom or the dad. And if it's the mom is the caregiver, even if she's the mom.
Yeah, but then I think in that case, whereby it is not the birth, it will have to be like guardian. Maybe that would be another option that we can put the guardian.
Okay.
Because even the mother, because the court system would have you as the parents for that child.
Okay.
But then you're the adopted mother. In that process, then you're just a guardian.
Okay, so I can put name of primary caregiver and then type of primary caregiver, whether parents, foster parents. Okay.
Because the foster parent or the guardian may not even be the adoptive parent.
Mm-hmm.
So that will make sense.
All right. So, okay. So I'll add that option. So if you are able to follow, you can use the case scenarios and practice before tomorrow. If not, we'll go over it tomorrow and then we'll do the practice in breakout rooms. And you are free to still practice by yourself in your private time if you have the time while you are home outside of the training time. So the system is always there. You can always log in, practice with as much records as possible, create accounts, refer them, try it out yourself if you have the time. If not, we'll have breakout rooms tomorrow and we're going to have practice sessions. Okay, so let's take introductions and attendance so that we close for the day. My name again is Mildred Fakoya. I am a software engineer, data scientist. I am the developer of this case-based system. I develop system for health and for education, and I mostly develop reporting system and system that tells stories.
Judy Nesbitt, CCC, Nevis. I think it's in Nevis.
Good morning, everyone. Alexandrina Wang, Antigua.
Good morning, everyone. I'm Kevin Gregoire, volunteer attached to the National HIV and AIDS unit, member of the Dominica Red Cross, and a director, secretary, and treasurer of Life Goes On Dominica Inc., who takes care of, who provides care, etc., to PLHIDs.
Hello, good morning. Latoya Mussington, Antigua.
A pleasant good morning. Lynthia Buckmeyer, registered nurse midwife attached to Grenada Planned Parenthood Association.
Good morning, everyone.
Blessed good morning to all. I am Glevel Williams from St. Vincent. I'm a registered nurse attached to the Infectious Disease Clinic. Have a blessed day.
Good morning, everyone. Roxanne Benjamin, Health Promotion Officer attached to the Ministry of Health.
Good morning. I'm Karen Broderson, PMTCT Coordinator and HIV Case Manager, Antigua Barbuda.
Juliana Darrow.
Morning, Andrea Williams. Go ahead, Juliana.
Yeah, Juliana Darrow, nurse midwife attached to the maternity unit in Dominica and acting ward sister.
Andrea Williams, rapid tester, St. Kitts and Nevis.
Radwan Batiste, Grenada.
Good morning, Silas Abiodun, Dominica.
Good morning, everyone. John L. Benjamin, the National AIDS Program Coordinator.
Good morning, everyone. Dr. Fernandez, medical epidemiologist from attached to the Ministry of Health of Antigua.
Good morning. Dr. Stephen Fajamilane, a guest.
Good morning, Bureau Ferdinand St. Vincent and the Grenadines.
Good morning, Judy Archibald, National HIV/AIDS Response Program, Dominica.
Okay, so if we are done with the introductions, we can call it a day, and thank you very much, and we will see you tomorrow.
Thank you.
Okay, thank you.
Thank
Okay,
you
bye-bye.
too.
Okay.
And bye.
Pleasant day to everybody.
Bye. Thank you.
Yeah, bye.